Still not hearing it.
Whew.
You all right? Yeah, how you guys doing?
Doing good, sir. Doing good.
Hanging in there?
Oh, yeah.
This is like the home stretch for you guys, isn't it? Pretty close.
After, after tomorrow.
Yeah, but we were talking about, hey, how do we
Yeah,
I know.
it's
and then you start clinicals after that?
they're already in clinicals.
Oh, they already are. Oh, cool.
Academy.
When's that gonna be?
It starts in May 28th.
Oh, dude, just a couple months.
Yeah, for the EMT portion.
Oh.
Those guys actually started today.
I was about to say they probably had to, or they started today for the fire portion and, oh, wow. So is that like a 5-6 month academy altogether? 6 months? Yeah. That's cool.
We're almost there.
That is
But-
cool.
Just keep that momentum.
Yep.
Heck, yeah.
Sir, good seeing you.
All right, likewise.
Have a good afternoon.
All right, you guys do the same. All right, welcome everyone. We are back for anatomy and physiology. The EMS professional. Thank you guys so much for being here, and we'll go ahead and get going. All right. Sweet. All right, so we're going to be talking about, I believe, the lymphatic system is what is in the module for this week's lecture. But I find having a discussion surrounding the concept of the lymphatic system is going to be very difficult. It's going to be very difficult to understand and retain any of that information if we don't cover some more foundational information. And so what I'd like to do is for the first half of the lecture, I'm actually going to talk a little bit about the immunological foundation as it pertains to the human being. And this is very similar in many mammals, at least, and virtually everything that's living, depending on how we define that term living, is going to have some sort of system that acts roughly analogously to the immune system. However, in mammals, this is a highly complicated, highly interrelated system that's going on. And it is one of the areas of the body where you actually have memory that plays a role. And this is the only, outside of the nervous system, this is actually the only other area of the body where the concept of memory even plays a role. So it is very unique in many ways. And so what I'm going to do first is I'm going to start talking about blood cells, the cells that inhabit your blood. So we talked about the cardiovascular system last week, and we talked about blood as a living tissue, and we know that blood as a living tissue essentially has several different cell types that are then encapsulated within an extracellular matrix, and that matrix in the terms of blood is essentially the plasma, which consists mainly of water and some other proteins like albumin, clotting factors, immunoglobulins or antibodies, etc. So let's talk about the cellular component of the blood. So we look in your blood, the blood contains many different types of cells and cell fragments and components. The most numerous cell that you're going to run into is the RBC, or we call that the red blood cells. This makes up a majority of the non-aqueous or non-water component of your blood, roughly 45%. If you were to take a sample of blood and put it into a centrifuge and spin it, the heavier stuff is going to shift to the bottom of that vial, and then the lighter stuff will be at the top. And roughly speaking, about 45%, give or take a few percent, of that entire sample of blood will consist mainly of red blood cells. That is a primary component. In addition to that, we have what are called white blood cells, and then we have platelets. And these three cells Although a platelet is actually a cell fragment, it's not a cell unto itself. But they form most of the mass or most of the packed matter within blood. And just as a review, this is going to be a review as far as terminology is concerned. Red blood cells are also known as erythrocytes. So an erythrocyte means the same thing as an RBC or a red blood cell. The platelets are also known as thrombocytes because they are often the first component of the clotting or of clotting. They form the initial temporary plug. The platelets essentially are activated, they aggregate, they come together, they become sticky in a sense. They come together and they form a temporary plug, and then the fibrin gets activated through the clotting cascade, and the fibrin essentially forms a more permanent plug on top of that. And there are a variety of pathways and a variety of clotting factors that turn inactivated molecules into activated molecules. And at the bottom of that complex pathway is a more permanent fibrin plug that forms on top of the platelet plug. And you have all of these factors floating around in your blood as well. White blood cells are also known as leukocytes. Leuko being white, cyte being cell, right? And when we talk about different cell types in your body, there's some terminology that you should also be aware of. There is a term that means an abnormally low number of cells, and that term is leukopenia. So for example, leukopenia, leuko white, penia low. So leukopenia is a low number of white blood cells, right? Anemia is a low amount of red blood cells and hemoglobin in your blood, right? So that would impact the erythrocytes, all right? Thrombocytopenia is a low number of platelets or thrombocytes. And so that's penia, low number. Cytosis, however, means an abnormal elevation in cells. So for example, leukocytosis would be an abnormal elevation in white blood cells of leukocytes. Right? So you've got penia and cytosis. All right, so when we look at the leukocytes, there are actually several different types of white blood cells. All right, with a red blood cell, basically all the red blood cells are the same, and basically all the thrombocytes or the platelets are the same. But the white blood cells, you have 5 major types of white blood cells. And I just remember the saying, never let monkeys eat bananas. To remember the 5 major categories of white blood cells. N are the neutrophils, L, the lymphocytes, the M are the monocytes, the E are the eosinophils, and then the B are the basophils. And those 5 types of white blood cells are divided into 2 major categories. And the 2 major categories include the granulocytes and the agranulocytes. And the reason we say that something is a granulocyte is when you look at it stained under a microscope, you see these little specks, these little dots within the cytoplasm of the cell, and they look like little granules. And what they really are, they are little cytoplasm encased, so they're in little vesicles, and they are different molecules contained within these vesicles that get released. So they can include things like histamine, digestive enzymes, pro-inflammatory molecules, various cytokines, and so on. And what happens is those granulocytes, when there is an injury or an infection, they can release those granules. So those vesicles will move out and fuse with the cell wall and release those granules, those substances out into the environment where the injury or infection is occurring. And then that causes a variety of other downstream effects to occur. And some of them can actually be directly damaging to pathogens like viruses or bacteria that may happen to be in that area, fungus, and even certain parasites as well. And so it is these granules of these various substances like histamine, like cytokines, even free radical or reactive oxygen species can be released, hydrogen peroxides and things of that nature that can be directly damaging to other cells. And then the other two belong to the category known as the agranulocytes, and these are white blood cells that when we look at them stained in a microscope, don't contain those little granules, granules of pro-inflammatory molecules. So the basophils, the eosinophils, and the neutrophils are what we call the granulocytes, whereas the lymphocytes and the monocytes are known as agranulocytes. And I also want to say that a monocytes are interesting in that they can easily leave the blood and go out into the tissues. And when a monocyte leaves the blood and goes into the tissues, we refer to that as a macrophage. All right, so monocytes become macrophages or macrophages when they leave the blood and go out into the tissues. There are other white blood cells that can go into the tissues. The other major one happens to be the neutrophils. And what happens with neutrophils is neutrophils get activated. So the neutrophils are typically in your blood. And then when you have a cell that gets damaged or there's an infection or an injury or something like that, the cells will release chemicals that attract neutrophils there. These are called chemokines that get released. And then there are other signaling like cytokines, for example, and other, other activating molecules that get released. And when those molecules activate the neutrophils actually attach themselves onto the inner surface of the blood vessel. And then they roll along the blood vessel until they get to a little junction that they can leak out, they can escape out, and then go to that area where those chemicals are coming from. And that's something referred to as diapedesis. When a neutrophil is activated, it attaches to the inner lining, the intimal lining of the capillaries, and then they roll along until they can squeeze through a little gap and get into that area where those signaling chemicals are being released by the tissues and other immune cells. All right, so these are the major players within your blood, the blood cells, if you will. So where do these blood cells actually come from? Well, these blood cells actually come from so-called stem cells in your bone marrow, all right? And so let's talk a little bit about blood cell production next to understand where these come from. And this will also help us understand certain types of pathology or certain disease processes that we run into, both within and outside of the hospital. So you have what's known as a multipotential hematopoietic stem cell. And this is all often referred to as the hematopoietic system. This is how we make our blood cells, all right? So it all starts with these stem cells. We sometimes call these undifferentiated stem cells. So it's a stem cell that has a potential to become many different types of cells, right? So it starts off as this multipotential hematopoietic stem cell. In terms of blood cells, we call these hemocytoblasts. And a blast is just a term that means an immature cell. It hasn't matured into its final form yet. All right. And then what happens is various hormones, cell factors, and other chemicals, okay, activate these cells. And what they do is they can activate and deactivate genes, typically genes within these stem cells. And that causes these stem cells to differentiate into more specialized cells. All right. And I'll talk about some examples, some specific examples of these signaling molecules here in a bit. But you have these hemocytoblasts, these stem cells, and then the factors get released and cause these stem cells to differentiate into their specialized form. And these hemocytoblasts can essentially further differentiate into two major categories of blood cells. And these are what we call the myeloid progenitor cells and the lymphoid progenitor cells. And these give rise to two major lines or lineages of blood cells, the myeloid lineage and the lymphoid lineage of blood cells. And some of you may have heard of the term leukemia. Leuk is in reference to a white blood cell, and leukemia is actually a cancer that involves the white blood cells specifically. And a cancer is a broad term for several hundred disorders where you have abnormal cells that are dividing. So you have an abnormal cell that divides and it has uncontrolled cell division. And when that happens, a tumor forms. And if the tumor spreads throughout the body, we refer to that as a malignant disorder. And if the tumor stays where it originates and just maybe it grows or maybe it doesn't, we call that a benign tumor. Typically, leukemias are malignant cancers, and that is to say that they metastasize. Metastasis is a term that means a tumor spreads beyond its origin. It spreads to other areas of the body. And that is what we call a malignant tumor if it metastasizes, whereas a benign tumor will tend to stay in the area of the body where it originates. But in any case, a cancer, you have cancer. Cancer is a broad term for when you have abnormal cells that are dividing uncontrollably. And in the case of leukemia, leukemia is a cancer of the white blood cells. And why that's important for us is the leukemia, depending on the type of leukemia somebody has, right, it's going to impact either the myeloid or the lymphoid lineage. So when you're looking at somebody's chart and maybe you see somebody has been diagnosed with something called ALL. ALL stands for acute lymphoblastic leukemia. Well, guess what? That is a leukemia that's acute. So it occurred very rapidly, and you have very rapid cell division, and it is progressing very rapidly, and it involves the lymphoid lineage. So it is abnormally dividing and spreading and metastasizing cells in the lymphoid cell line. You can also have something called AML, acute myeloid leukemia, and that is a leukemia that involves the myeloid lineage, all right? And then you can have chronic leukemia as well. So you can have like CML, chronic myeloid leukemia, okay? So you can have both acute and chronic forms of leukemia, all right? And leukemia falls into the category of something called a blood cancer because it impacts the blood cells. All right, so you've got these stem cells, these multipotential hematopoietic stem cells, these hemocytoblasts, And they further subdivide either into the myeloid progenitor stem cells or the lymphoid progenitor stem cells. So let's take a look at the myeloid progenitor stem cells. What do these stem cells do? These stem cells, in response to hormones and other chemicals that trigger them to further differentiate, will differentiate into either megakaryocytes. These are very large cells that then break down into platelets. So platelets come from megakaryocytes, which come from myeloid progenitor cells, which come from the hemocytoblast, the hematopoietic stem cells in your bone marrow, right? So this has to specialize into the myeloid, has to specialize in the megakaryocyte, breaks down into platelet. All right, so that's where platelets come from. All right, so they belong to the myeloid lineage or the myeloid cell line. The red blood cells also come from the myeloid progenitor cells, and there is a very special hormone. A hormone is a chemical that is released by a gland. And that's an important term that I want you all to remember, gland. Glands are actually part of your endocrine system and they release hormones. Nodes are part of the immune system, the lymphatic system, and they do something very different. All right, and glands can become swollen and nodes can become swollen. You need to know the difference between a gland and a node. But in this case, a gland, or something that acts like a gland, secretes a hormone called erythropoietin. And when that hormone is secreted, and erythropoietin actually happens to come from your kidneys, so your kidneys can act like an endocrine organ in addition to other functions. So the erythropoietin is released by your kidneys into your blood. It then circulates to the marrow and throughout your body, and it causes these myeloid progenitor cells to differentiate into red blood cells, right? So this is an example of a hormone or a cell factor that activates and deactivates genes within these progenitor cells to cause them to further subdivide. And so what we can see is if somebody has kidney disease, where their kidneys are not able to produce erythropoietin, they become anemic because they can't manufacture red blood cells. In addition to that, if you are malnourished and you don't have the raw material to make these cells, you will also have problems, right? For example, when it comes to red blood cells, you need adequate amounts of folic acid. You need adequate amounts of iron, right? You need thymine, right? And if you don't have these raw materials, these nutrients, you won't be able to manufacture some of these cells as well. All right. And so sometimes people that have problems with red blood cell production, we actually have to give them injections of erythropoietin. And that is often done in people that have chronic renal disease or chronic renal failure. Okay. Another cell that can come from the myeloid progenitor are what we call your myeloblasts. Remember, blast just means an immature cell. So a blast is immature and it needs to further mature, further differentiate. So the myeloblasts can either become basophils, neutrophils, eosinophils, or monocytes. All right. So you can see that 1, 2, 3, 4 of the 5 major white blood cell types come from your myeloblasts. So 4 out of 5 of the major categories of white blood cells come from the myeloid progenitor, or belong to the myeloid lineage. And then remember what happens when a monocyte leaves the blood, it gets a name change, and we call that a macrophage or a macrophage. So macrophage is just a monocyte that has left the blood. It's gone out of the blood and it's gone into the tissues or the interstitial space. All right, so these are the myeloid These are the individual cells that come from the myeloid cell line. Let's talk about the lymphoid progenitor, the lymphoid lineage. There are the natural killer, the NK lymphocytes that come out of that. And then there are what we call the small lymphocytes. And the small lymphocytes further divide into either what are called the T lymphocytes or the B lymphocytes. Okay. And a T lymphocyte, we call that a T lymphocyte because it matures in response to hormones, okay, from the thymus gland. That is actually a gland that lies near your heart in the mediastinal cavity, and it releases thymosin that causes T lymphocytes to mature. So it causes these small lymphocytes to mature into T lymphocytes. And so what we find is if people lose their thymus gland, especially when they're children, prior to their immune system being able to really develop, because that's actually an important part of being a child, is coming into contact with lots of different pathogenic microorganisms, and you get sick a lot, right? Any of you that have children know this, right? Kids are just getting sick all the time, right? They are training their immune system, and that's part of it. And so if you lose the thymus gland as a child, those individuals tend to have a lot more trouble with their immune system. They're immunocompromised as they grow up. But it is the thymus gland that causes these to mature. That's why we call them T lymphocytes. The B lymphocytes, however, they actually mature in the bone marrow. There are factors within the bone marrow that call them to mature, so we call them B lymphocytes for that reason. All right. And I'll also say that B lymphocytes, when B lymphocytes produce antibodies, we call them plasma cells. So plasma cell is just another term for a B lymphocyte that's spewing out antibodies, because that's what B lymphocytes do. That's their major job, is to manufacture and release antibodies. Right. All right. So we've talked about blood cells, and we've talked about where the blood cells come from. All right. So now what I want to do is I want to just take a very broad look at the immune system. This isn't going to be a real deep dive, but it's going to be kind of a superficial, high yield overview. And once we get through that, we understand what blood cells are, where they come from, and how they fit into the immune system. Then I can finally talk about the lymphatic system, because the lymphatic system really plays a critical role in the immune system. A lot is going on there. And so if we understand this stuff first, it's going to be a lot easier to understand the lymphatic system. And then when I pull the PowerPoint up here in the second half of the lecture, all of this will make a lot more sense. It'll be a lot easier to understand. Well, let's talk about the immune system. So the immune system its essential job is to protect the body, from foreign invasion. And anytime a life form from outside of the body invades the body, we call that a pathogen. A pathogen is a biological agent that can cause disease. So it's from the outside. Just sometimes you have pathogens that live within your body, within your intestines, for example, your body, what we call your microbiomes, or they may live on your skin, but they get into your blood, into your tissues. All right, these are called pathogens. And these pathogens can be a variety of things. They can be bacteria, they can be viruses, they can be fungal, they can be parasitic, worms, amoebas, things of that nature, right? And so that's one of the major roles of the immune system, is to protect us from pathogens. And when a pathogen gets into your body and it begins to dividing inside your body and causing problems, we call that an infection, right? And it responds to infection. The other thing the immune system does is it responds to injury. If you get injured, right? If you twist your ankle, for example, what happens? It hurts and it starts swelling up. It gets red and it gets hot. It gets inflamed. That's actually part of your immune system. So your immune system is also there to help you heal and respond to injuries. All right. So injuries and pathogens. All right. The third major thing that your immune system does is it identifies abnormal cells. So when a cell becomes abnormal and doesn't work right, the immune system has to identify that and then signal to that cell typically. It'll signal, hey, you need to kill yourself because you're causing problems. And when that happens, the cells will die through an orderly process known as apoptosis. Apoptosis is a term for programmed cell death. Now, guess what? There are some cells that they won't respond. They will become abnormal and they will start dividing abnormally and they won't respond to your immune system. And when that happens, that's cancer, right? Oftentimes cancer cells do not respond to your immune system. Your immune system's not able to tell them to kill themselves through apoptosis. They won't respond because they're abnormal and they have mutated and they have defenses against that. But a very important part of your immune system is to identify what we call self versus non-self cells. And this is done through proteins that are on the surface of every single one of your cells. And these proteins are called MHC proteins or major histocompatibility complex, MHC. And think of MHC as like a secret handshake, right? So you've got your immune cells, right? Your white blood cells, right? Specifically the lymphocytes. And they're running along and they're running into normal cells in your body. And they're like, hey, how are you doing? Oh, you've got this MHC protein that oh yeah, you're good to go. Oh, wait. You don't have this MHC protein, or the MHC protein that you're expressing isn't normal. I'm going to attack you, right? And whenever that mechanism fails, the body can actually attack its own healthy cells sometimes when you have a failure of this mechanism. And that is referred to as an autoimmune disease, when the immune system attacks its own cells. And usually or often what happens is you will have an infection and your body can't quite tell the difference between normal cells and the infected cells. And this seems to be the basis for many autoimmune diseases. For example, type 1 diabetes is thought to be an autoimmune disorder. And typically what happens is we see this occur in children who recover from a viral infection. And there are cells in their pancreas, the islets of Langerhans in their pancreas, that look close enough to the virus infected cells that the immune system ends up attacking those cells within the pancreas. All those cells go away, and now that person is no longer able to create insulin because the insulin producing cells have been destroyed, right? And so we do see that happen where somebody has an infection and then that causes a malfunction of that non-self mechanism. We see this with certain neurological disorders like Guillain-Barré syndrome, transverse myelitis that can occur after viral infections as well. So we do see these mechanisms fail for various reasons. Okay, so let's just talk about the two major components of the immune system. The first major component of the immune system is what we call the innate immune system. And the innate immune system is present in every single person. And it is present the day that you were born. Everybody has this. And there are two major components to this. There are what we call the barriers. So these are the physiological, the anatomical barriers that prevent pathogens from getting into your body. For example, intact skin. Intact skin is very good at preventing pathogens from getting in. Mucosa, right? Anywhere the inside of your body is interfacing with the external environment, you will have a mucosa. You'll have a mucus layer protecting that, right? So that's why your respiratory tract is covered in mucus. That's why your genital urinary tract is covered in mucus. That's why your gastrointestinal tract is covered in mucus. You have a mucosa there. Intact mucosa protects saliva, stomach acid, and tears, right? These all act as barriers to prevent stuff from getting into your body. Right? But what happens if these barriers are broken? If an organism gets through those barriers, or there is some sort of injury that causes injury to those barriers, then the next component of the immune system is called inflammation, right? And inflammation is essentially four major things occurring. You have heat, you have swelling, you have pain, and you have redness, also known as erythema. Erythema means redness. What is the role of inflammation? Why does this happen? Well, there are several reasons for inflammation, right? The first thing that happens is you have cells embedded within your tissues called mast cells. And those mast cells can release something called histamine. And the histamine actually is one of the primary components of inflammation that kind of starts the process off. And so what happens is it causes your blood vessels, your capillaries, to open up and become leaky. And the technical term for that is increased capillary permeability. The capillaries become more permeable. And so what happens is the histamine gets released, and there's some other chemicals, some chemokines that can get released from damaged and dying cells that will do this as well. And that will cause your capillaries to dilate and the little gap junctions in them to open up. And then why? Why do we want that? Well, that allows immune cells, that allows white blood cells in your blood to get out easier and go into that area where you have an injury or an infection, right? And so that's why you get the swelling, right? Because fluid leaks out of the capillaries into that area where you have the infection or the damage occurring, right? It swells up. The temperature in that area increases, right? And that increases metabolism, and that may make the cells in that area work a little more efficiently, and the elevation in temperature may actually impair the function of certain pathogens. Certain pathogens may not work as well in the setting of an elevated temperature. That's why we will often have an elevation of our body temperature when we're fighting an infection. You get what's called a fever, also known as hyperpyrexia. Pain, right? Why do we have the pain of inflammation? Well, because that lets us know something's going on. Hey, you twisted your ankle. Might want to stop running on it and take care of that, right? Or hey, your arm really hurts where you have this infection. You might want to get that dealt with. And then obviously redness, because you have more blood and nutrients going into that area. Now, the thing about inflammation is actually very damaging, because you have these granulocytes going in and they're dumping all of these, frankly, toxic chemicals, right? Reactive oxygen species and free radicals, and they're just dumping them into that area, trying to kill off the pathogens, but that can also damage your cells. So the inflammation has to go away when it's no longer required, right? And so if you have a situation where you have chronic inflammation, that can actually cause lots of problems, right? And there are lots of diseases where we see chronic inflammation, and instead of helping, it actually injures. For example, there are certain kinds of arthritis where you have chronic inflammation of your joints, like osteoarthritis, rheumatoid arthritis, which is actually an autoimmune disorder. And what happens over time is your joints actually break down and they quit working, and you might lose the ability to use your hands, for example, with severe forms of arthritis in your hands, right? We see people that have chronic inflammation of their intestines. That can cause problems. That can increase the risk of them developing cancer. It can increase the risk of them developing infections. And so chronic inflammatory disorders are very damaging. So you really should, inflammation is really kind of an acute process. It occurs immediately following the infection or injury, but then the inflammation needs to go away once things have been dealt with. And if it doesn't, that can actually cause more injury. Now, alongside of that, there's something called the complement pathway. And the complement pathway is just a bunch of proteins in your blood. And then these proteins can get activated and they complement the innate immune system, and they can actually complement the adaptive immune system. And they can do a few things. They can feed into inflammation and cause more inflammation. They can help inflammation occur more efficiently. That's one thing that a complement pathway activation can do. Another thing that it can do is it can cause like almost like a spear, like a hollow needle to form, and it can bore into pathogens, and that's called a MAC, or a membrane attack complex. And so it can form like these sharp needles and essentially put a hole or a pore in the pathogen, and then the pathogens start leaking their guts out essentially. And then the other thing that it can do is it can actually help with antibodies, which we'll talk about here in just a few minutes. All right. All right. Now, a really important part of this is this inflammation causes white blood cells, specifically the neutrophils and the macrophages or the phages, right, which become monocytes. So the neutrophils and the macrophages actually leave the blood and go into that injured area. They're attracted by the inflammation. And these are like your frontline soldiers. These kind of look for anything abnormal and then they gobble it up. So like, is there anything weird in here? Hey, that looks kind of weird. I'm going to gobble it up. They gobble it up. That's called phagocytosis or phagocytosis. It literally means to eat. Cellular eating, cytosis, right? Cyte being cell, tosis, increased activity, right? So they eat stuff. Now, they can do something very special. When they phagocytize a pathogen, right, all cells have complex proteins in them, right? And what these cells can do is they can identify complex proteins, typically in the cell wall of the pathogen that they have phagocytized, and they can be like, this is a really unique looking protein. I've never encountered this before, right? And then what they'll do is go, this is so unique that we could use this to identify other pathogens, right? So it's kind of like, if you look at a picture of somebody, we all have unique features that can be used to identify us. Kind of a similar thing happens here, but it involves a protein. And that is something called an antigen. So pathogens, viruses, bacteria, fungi, pathogens embedded in their cell wall have what are called antigens. And an antigen is just a protein that is unique to that pathogen that can be used to identify that pathogen. And so what they do is they identify the antigens within the cell wall, those pathogens, and then they deliver those antigens to the other part of the immune system, and we'll talk about that next. All right. So that's what we see here in the innate immune system. Now, the other major part of the immune system is what we call the adaptive immune system. And the adaptive immune system is where you actually have the memory occurring. All right. So we have two major components of the adaptive immune system. You have what's called the humoral and the intracellular, the cell-mediated. All right. The humoral, that term humor actually comes from ancient Greece, where the Greek physicians refer to as the humors. And a humor refers to body fluid. Right? So these are things that are occurring within your body fluids, your blood, your bile, etc. Right? And so the humoral is actually occurring within your blood, right? So I just want you to think of humoral is in the blood itself, primarily within your blood, right? And the most important part of the humoral system are these B lymphocytes. So remember we talked about the B lymphocytes here. And the B lymphocytes, what's their job again? What's their major job? They produce something. Antibodies, awesome. So the B lymphocytes, their major job is to produce antibodies. So the B lymphocytes actually turn into plasma cells. And when a plasma cell, when they get converted into plasma cells, they're actively producing antibodies. So the way that this works is the antigen presenting cells over here in the innate immune system, primarily the neutrophils and the macrophage, and there are also some other cells called dendritic cells. That just kind of hang out in your tissues. They don't move around like the white blood cells, so they're not really white blood cells, but they kind of do the same thing as macrophages and neutrophils, or monocytes. So they present these antigens. They say, hey, B lymphocyte, here's an antigen that you can use to identify this pathogen. And so the antigen presenting cells present the antigen to the B lymphocytes, and the B lymphocytes go, oh yeah, I can create an antibody against this antigen. And when that happens, the B lymphocyte becomes a plasma cell, and then it releases antibodies. And antibodies are typically kind of Y-shaped proteins like this. All right. And then they have this bottom of the Y here, and that is called the FC region. I'll often referred to as the fragment crystallized region. And this isn't actually where most of the magic happens. It's in the actual open, the V part of the Y up here. And this is called the FAB region. And that stands for fragment antigen binding. So the cool thing that antibodies do, or one of the cool things they can do a few things, but one of the major things they can do is, so you have this pathogen here, right? And this pathogen has some unique protein there. All right. And so the antigen presenting cells, macrophage, the monocytes, which are macrophages, the neutrophils or the dendritic cells, phagocytize that. All right. And then they present that protein to the B lymphocytes. And then the B lymphocytes take that antigen and they go, huh, I'm going to incorporate this into an antibody. And then they create this antibody that uses parts of that antigen and how they're produced. And then what happens is those antibodies then can get released by the plasma cells. And let's say you have another antigen here, right? And then the antibody will attach itself to the antigen on that pathogen. So the antibody gets released, it attaches, and then it can deactivate, it can destroy, it can cause them to fall out of solution, right? And so all these antibodies just get spewed out, and the antibodies, every specific type of antibody is specific to one type of antigen. And that's how you respond to that infection, right? These antibodies are released, they attach to the antigen of the pathogen, or sometimes this might be your own body cell, right? So maybe this is your own, this is a cell in your body, but it's been infected by a virus, and it's making viruses that have those antigens. Those antibodies can also attack those as well. But primarily, they will directly attack, if you will, the antigen on the surface of the pathogen, be it a bacteria, virus, or some other pathogen. That kind of makes sense. And the cool thing about this is we can actually make these. We can actually produce antibodies in the lab. And we can use antibodies to treat certain kinds of toxicity. For example, what we can do is we can take several types of snake venom, and we'll inject venom into animals, typically horses. And what will happen is, when that happens, the horse's immune system will go, hey, this is a foreign protein. I'm going to start making antibodies to attack that foreign protein, right? And then the horse's immune system will make a bunch of antibodies, and then we will draw the blood off of that horse, pull the plasma out, and get those antibodies. And then what we'll do is we'll take those antibodies and we'll inject chemicals that cut that long region off the antibody, the FC region, and we'll just have the Fab region of the antibody. And then this is what we administer to someone who's been bitten by a snake. And that medication, one of them is called Fab. That's one of the two major antivenoms that we give to people who've been bitten by snakes. And that stands for crotalid. You guys know what crotalid means? It's a type of snake. So crotalids are pit viper snakes. So like water moccasins, sidewinders, rattlesnakes, those are all what we call crotalids. So that's where the term crow. And then where do you suppose the term Fab comes from?
The top part of it.
There you go. It's a top part. It's the Fab region of the antibodies that we use. So we call it ProFab. Yeah. Actually, virtually all of the antivenoms that we have available, that's how they're made. They actually use antibodies. There are actually some antibodies against drugs. There's a drug called Coumadin or warfarin. And if somebody overdoses on that, there is an antidote to that called Digibind. And again, it's just an antibody. It's the Fab region of the antibody that you can administer that then binds to and deactivates that specific drug. So yeah, these can be used therapeutically as well. Okay, now, so that's what the B lymphocytes do. Now let's talk about the intracellular or the cell-mediated component. So this is actually happening mainly outside of the blood. So this is happening in the tissues, and this is primarily involving abnormal or virus-infected cells. And this is where the T lymphocytes play an important role. So the B lymphocytes are making the antibodies, and the T lymphocytes are doing something else. And there are two major categories of these T lymphocytes. They're what we call the CD4 positive T cells. And these are T cells that have a special protein called CD4 in their cell wall. So we say they're CD4 positive. We often just refer to them as helper T cells. And essentially what they do is they help activate the B lymphocytes. So you need helper T cells to activate the B lymphocytes and to convert them into plasma cells. That's what a helper T does. And then you also have something called a killer T cell. And a killer T cell has a special protein in its cell wall called a CD8 protein. So these are sometimes referred to as CD8 positive T cells. And the killer T cells are the T cells that play a really important role in identifying and killing virus infected cells and faulty cells. Like, hey, you're not working right. I'm going to tell you to undergo apoptosis so you don't become cancer or something else, right? And so because they cause the death of other cells, we call them killer T cells. And remember, how do these T cells know what's going on? Well, primarily they use the major histocompatibility complex system to communicate. And there are different types of MHC as well, but we won't go into that sort of detail today. All right. Now, there is some interesting pathology surrounding these T cells. There are some diseases. There is actually a viral infection where the infection actually involves the helper T cells. The virus actually infects these cells and kills these cells off. And so when you get infected by that virus, what does that do? Well, that prevents the B lymphocytes from being activated and it suppresses your immune system. And the name of that virus is HIV, human immunodeficiency virus. That's how it works. And that causes immunosuppression. And then what happens is you become unable to fight off infections and to fight off cancer. Many people with HIV, if they're not treated with antivirals, will die of cancer. Like cancers are very common. Kaposi sarcoma is one example of a cancer that is more common in HIV, people that have HIV. And then, of course, when that virus kills off a sufficiently large number of these helper T cells, then we call that AIDS, right? So AIDS is actually the disease of immunosuppression that HIV causes. AIDS stands for acquired immune deficiency syndrome. And there's a certain, I can't actually tell you what the value is right off the top of my head right now, but once the CD4 positive T cells go below a certain value, then we say that someone now has AIDS because they are so compromised. Although that is not as common in modern countries because our antiviral therapies are so effective that people that have HIV now can expect to live a long, healthy life and will have a life expectancy that is roughly as good as anyone else. So our ability to treat HIV is so much better. It's actually like many people will again go on to live long, healthy lives with HIV. And there are actually other diseases that are like diabetes, for example. Diabetes is on average far worse than HIV because the complications we see in people who are diabetic is just horrible. It can be hard to treat and so on and so forth. Okay, so we're good there? How are we doing on time? Okay, cool. I am going to lecture for a few more minutes and then we'll take our first break. So what about the lymphatic system? Where does that come into play with all of this? Well, the lymphatic system is really interesting. And before I really dive into the lymphatic system, one thing you guys have already talked about where fluid can exist within your body, different compartments. All right, cool. So you have fluid that can exist within the blood vessels, right? And we call that the vascular compartment, right? And then you have fluid that exists within the tissues, within the cells that are in your tissues, right? And we call that the intracellular compartment, right? And then you have this space in between the tissues, and what is that known as? The interstitial. Awesome. Inter being meaning in between. Good. All right. So the lymphatic system actually is a system of tiny little vessels called lymphatic capillaries. And essentially what the lymphatic capillaries do is they absorb fluid out of the interstitial space. And fluid that is in the interstitial space doesn't automatically go back into the blood. It has to go through the lymphatic system first. So if you cut yourself, if you have an infection, if you have inflammation, right, that fluid that accumulates in that area, that inflamed area, that fluid gets absorbed by these lymphatic capillaries. These are tiny microscopic capillaries, and they run alongside your capillaries and your blood vessels, right? They run right along, right next to your circulatory system. And then that fluid goes through those capillaries into larger lymphatic vessels known as collection vessels, and then into the largest vessels. And then those vessels drain into a structure called a lymph node. And think of the lymph node as a kind of filter for the lymph or the lymphatic fluid, right? That is being drained out of the interstitial space. And so that fluid goes into the lymph node through what are called afferent vessels. So the lymphatic fluid is coming in, and you have lymph nodes collected in specific areas of your body. You have collections of lymph nodes in specific areas of your body, where lots of lymph vessels come together. And you have congregations of lymph nodes. So you have a lot of lymph nodes in your neck. These are called your cervical lymph nodes, and they drain lymph that is coming out of your head, your face, your neck, your nose, your ears, all that's draining into your cervical lymph nodes. You have lymph nodes in your armpits or your axilla. These are called your axillary lymph nodes, and they are draining lymph that is coming out of your arms mainly and some of your chest. You have a bunch of lymph nodes in your chest, in your lungs even. You have a bunch of lymph nodes in your gastrointestinal tract, and then you've got a bunch of lymph nodes in your groin that that the lymphatic drainage coming from your legs is going into. And you have approximately 600 of these nodes spread throughout your body. So the lymphatic fluid comes in, and you have these like pyramid-looking structures inside of the lymph node. You've got the outer part of those structures known as the cortex, and then the inner part is known as the medulla. And you have different white blood cells in different areas of the lymph nodes. So what you have is in these outer parts here, you have B cells, you have dendritic cells, and you have the macrophages in the outer cortex. So you have antigen presenting cells out here. So think about it. If you have an infection in your hand, and then that lymphatic drainage that's coming in that has bacteria, maybe it's a bacterial cellulitis. And so you've got some bacteria in that lymph fluid, and then when it goes into the lymph node, that bacteria encounters these antigen presenting cells, right? And what do? They phagocytize it, and then deeper into the lymph node in the medulla is where you have the plasma cells. So you have the antigen presenting cells are gobbling up the pathogens, presenting the pathogens to the B cells, and then those B cells are being converted into plasma cells in the middle of lymph nodes, and then they are releasing antibodies, right? That makes sense. Oh, you want that to happen before this lymphatic fluid leaves the lymph node through the efferent vessels, and then eventually the lymphatic drainage goes into your vena cava. That's where all the lymphatics go back into your vena cava. And so these are kind of like filters, if you will. These are immunological filters. But the other thing that they do is if there is some downstream infection or inflammation, these lymph nodes will become active, right? And they will have more white blood cells in them and they will begin to swell. And that is referred to as lymphadenopathy when a lymph node swells. Lymphadenopathy. Okay, and that is common if you have an infection in your hand, you might get lymphadenopathy of your axillary lymph nodes. Or if you receive an immunization, right? And what is an immunization? Well, immunization is you take a part of a virus or bacteria, and you take the antigenic part and you inject that into the body. And then what happens is that antigen that you inject into the body gets sucked up into your lymphatics, and then it makes its way into the lymph nodes where it encounters the APCs that then present it to the B cells, and then the B cells become plasma cells and they start making antibodies. And so sometimes you will get lymphadenopathy after an immunization. However, let's say you have a blood cancer and you have an abnormal accumulation of white blood cells, guess what? That can also cause your lymph nodes to swell. So certain kinds of cancers can cause lymphadenopathy in addition to infections. And sometimes you can even have a cancer of the lymphatic system itself, and that is known as a lymphoma. Right? So leukemia is a cancer of the white blood cells, specifically either the myeloid or the lymphoid cell lineage, whereas a lymphoma is a cancer of the lymphatic system itself. So they are very related and they are both considered blood cancers. All right. And before we take our break, the lymphatic system has several components to it. So you have these little lymphatic capillaries that I talked about. And then those capillaries become lymphatic vessels. And then those lymphatic vessels drain into lymph nodes, and you have approximately 600. They're not glands. Remember, glands are part of your endocrine system. And then you have specialized lymphoid structures that are not quite lymph nodes, but they function in a very similar way. For example, the tonsils, right in the back of your throat, your palatine tonsils, your adenoid tonsils are a type of lymph node. Your spleen, which is an organ that sits in the left upper quadrant of your abdomen, your spleen also functions like a very large lymph node. It does some other things as well, but it does function like a large lymph node. And then you have a bunch of tissue in your intestines. And this tissue is referred to as the GALT tissue, and that stands for gut-associated lymphoid tissues. Anytime you see the term gut in medicine, that means your intestines. So you have all these specialized tissues in your intestines that act like lymph nodes. An important one that you want to know are what are known as Peyer's patches. And these are little patches of tissue primarily embedded in the small intestine. So they're not like standalone lymph nodes, but they're like little structures within the intestine itself, underneath the mucosa, that do essentially the same thing as lymph nodes. So you have all of this lymphoid tissue in your gastrointestinal tract. And all of this collectively makes up the lymphatic system. All right, good to go there. All right, so let's take a good 10-minute break, and we'll come back and I'll pull up the PowerPoint, and hopefully we'll just be able to rush right through that. It'll make a lot of sense. Put this on pause. Okay, there we go. Just get recording here, start video. All right. Here's a PowerPoint I was talking about. So this should, I think going through this will be a lot easier now that we have some foundation. Before we hit that up, I just wanted to mention one more thing. And that is, these plasma cells here. These plasma cells don't produce antibodies forever. Once the infection is dealt with, the plasma cells will actually go into a dormant state. They're still going to be around, but what they'll do is they'll stop producing antibodies and they'll go into a dormant state, waiting to be reactivated again the next time you come into contact with that pathogen. And when that happens, they become what are called memory cells, memory B cells. And that's where the part of the memory of your immune system comes into play. The other part of the memory are actually in the T cells, because a very specific T cell is needed that has memory to activate a memory B cell and turn it back into a plasma cell. And so you do have that memory. And then over time, the antibody concentrations go down, and even over time, the memory cells may go away. And so occasionally, particularly with immunization, people may need to have another immunization to kind of restart and make a new set of plasma cells that then become memory cells, like with tetanus, right? Every 5 to 10 years, you need to have a new tetanus shot. So sometimes that needs to occur as well. Okay, so this is out of Canvas. So you can reference this PowerPoint. I believe this is chapter 7, which specifically talks about the lymphatic and immune system. All right, so here's some of the objectives. Talk about the function of the lymphatic system. Talk about the vessels, how is lymph formed, where are these lymph nodes. Talk about the thymus, which we've actually already covered a lot of this already, right? We talked a little bit about immunity. All right. We'll talk about B and T cells, which we already have. All right. We are going to talk in this PowerPoint, talk a little more about immunoglobulins. What are immunoglobulins also known as? Yep, antibodies, the same thing as an immunoglobulin. And there are several categories of antibodies, and we'll talk about those in just a little bit of detail. And we've already actually talked a little bit about how vaccines work. All right, so let's talk about the lymphatic system. It transports fluids through a network of vessels, right? I thought I heard a knocking, but
Yeah.
yeah. Oh, okay. He's going to the other room there. Not us. All right. Yeah. So what does it do? Well, it pulls fluid out of the interstitial space, and then that fluid that's called lymphatic fluid, goes through the lymph nodes, and then gets put back into the vena cava. All right. And its job mainly is to produce, maintain, and distribute lymphocytes specifically. And of course, that fluid, right? But that fluid contains antigens and sometimes pathogens that can then be used to activate the lymphocytes. All right. So you have these special lymphatic capillaries, and they're everywhere, right? They're located even in the small lining of the small intestine, right? And there are all these little chemicals biochemicals in there as well. So this is just kind of a simplified diagram of how that process works. Right, so you have the capillaries up here, the tissue beds where you've got fluid in the interstitial space. That fluid gets absorbed through the lymphatic capillaries, lymphatic vessels, goes into the lymph node. Any pathogens or antigens then meet the antigen presenting cells, which then present the antigens to the lymphocytes, the B lymphocytes, and then the B lymphocytes mature into plasma cells. And then once that fluid is essentially filtered through that lymph node, it then goes and ultimately goes back into the vena cava through a large duct called the thoracic duct, and that's how that fluid gets recirculated back into the circulatory system. All right, so lymphatic vessels only carry fluid away from the tissues, right? And lymph is just the name of that we give for the fluid inside of those capillaries. So here's just kind of a diagram of the lymphatic vessels. And that's roughly analogous to what I drew on the board for you all. Lymphatic vessels, like veins, have little valves in them because they're very low pressure, right? And just like veins, they mainly rely on skeletal muscle motion to kind of push fluid through, right? And then that fluid eventually goes into the lymph nodes, all right? And then eventually that goes into the thoracic duct, which then dumps that lymph back into the venous circulation, where it is reincorporated into the blood. All right, and then this is just a picture of the lymphatic vessels, and you can see that they run alongside all of your major blood vessels, right? And remember, you have these approximately 600 lymph nodes, and you tend to have collections of them in areas where you have lots of lymphatic vessels coming into the core, right? Such as the armpits, the axilla, in the neck, the cervical vessels, and the groin, and then obviously within the lungs and the abdominal cavity. All right, lymph, thin plasma-like fluid, right? Basically the same as tissue fluid, right? Because that's where it's coming from. It's coming from the interstitial space, right? All right, it's made up of water, very similar to blood plasma. That should make sense. That's mainly water. All right, and there we go. Movement of lymph, like I said, skeletal muscle activity, really important for lymphatic flow, just like it is for venous flow. Very low hydrostatic pressure. So you need to have a continuous movement, and you need to have those valves to prevent that lymph from essentially undergoing retrograde flow. And if you have damage to the lymphatic system, you may have an inability or difficulty in removing excess edema. So if you have fluid accumulating in your interstitial space, you may not be able to remove that. And so certain people that have had like surgery, specifically surgery for certain cancers, because there are many cancers that actually use the lymphatic system to spread throughout the body. A big one is breast cancer. Breast cancer, typically those tumors will spread to the lymph nodes and then spread throughout the body from there. And so often what we'll do is if we surgically treating someone that has a tumor in their breast, we will remove the lymph nodes in the axillary area, right, on the side that they have that tumor. And after the surgery, because we have essentially limited the lymphatic system's function in that area, they will have difficulty removing fluid from that arm that's involved. And typically, if someone's had a mastectomy, surgery for breast cancer, they should not receive an IV on the side where they have the surgery, because any fluid that leaks out of there might not be reabsorbed appropriately. All right, we talked about them. They tend to be very small, bean-shaped, can be up to 2.5 centimeters in length. They're often smaller than that, and they contain a lot of white blood cells like we talked about. All right, so you've got the hilum, which is the indented region where blood vessels and nerves are coming in. And then you have the capsule that surrounds the whole thing. That's the outermost part of the lymph node. And here's that picture, and this is essentially the picture that I drew for you, right? So you have this outer part here in the cortex, right? So you've got the lymph coming in through these afferent vessels. It's coming into contact with the cortex, where you have the antigen presenting cells that are taking in the antigens and presenting them to the B cells, the B lymphocytes. And then in the inner part here, in the medulla, you have the B cells becoming plasma cells and releasing antibodies. And then that lymph fluid, after it's gone through this, right, and hopefully those pathogens that have been filtered out, then it leaves the lymph vessel to go ultimately into the thoracic duct and into the vena cava. All right. We talked about the major collections of lymph nodes. I talked about how the tonsils, you actually have multiple actually, more than 3 sets. You've got the palatine, the pharyngeal, the lingual, you've got the adenoid tonsils as well. And they are very important when it comes to your upper airway. And that makes sense, right? Because this is a major area where the outer environment, the external environment, is interfacing with the internal body, right? In your mouth and your nose. All right. Do you remember Peyer's patches? I mentioned those earlier in your gut. All right. We talked about lymph nodes already. Talked about the thymus, right? The thymus is very important in the maturation of lymphocytes, specifically the T lymphocytes, right? We talked about the spleen. Okay, the spleen is a lymphatic organ, is basically a very large lymph node. It contains both white and red pulp inside of it. The red pulp is where you have lots of red blood cells. And so if you lose a lot of blood rapidly, the spleen can actually inject that collection of red blood cells into the body. So it's kind of like a temporary reservoir for blood. And then red blood cells actually die in the spleen and they start to break down in the spleen. So the spleen is just a more complicated lymph node. It's a lot larger as well. So there's just a picture of where the spleen is there in the left upper quadrant of the belt of the abdomen, in its basic structure. All right. So we talked about the immune system already. All right. It's responsible for providing immunity. Immunity is the ability to resist damage from foreign substances, pathogens primarily, and harmful chemicals. Now, just because you're immune to something doesn't mean that you will not get infected, right? Immunity does not mean you won't get infected. It means that if you become infected and you've encountered that pathogen before and your immune system's working, you will be able to rapidly respond to that infection and prevent it from becoming bad. There are a lot of people that think if you've been vaccinated or you've had an infection before, that immunity means you can't get infected again. No, that's not the case. You will get infected, right? And it will start infecting cells. But if your immune system's working, those memory cells can rapidly be converted back into plasma cells and start dumping antibodies out again, and you will fight that infection off before it becomes really problematic. And that's why some people who have been immunized can still get infected, but the infection will often be far less severe. And we talked about infection. It can be caused by viruses, bacteria, fungal, protozoal, single cell, and even multi-cell parasites as well. All right. I already talked about the innate versus the adaptive immune system. All right. We talked about the innate immunity, right? Talked about mechanical barriers, chemical barriers, right? Like stomach acid, enzymes in your tears, fever, inflammation. We talked about the inflammatory response, and there are a whole bunch of chemicals that can cause inflammation, like histamine, kinins, the complement pathway. We talked about that already. Prostaglandins and leukotrienes. And prostaglandins and leukotrienes, and many of these substances actually belong to a larger category of molecules called cytokines. You hear that term cytokine. Cytokines are pro-inflammatory molecules that tend to activate certain parts of the immune system. And these include prostaglandins, leukotrienes, interleukins. If you ever heard that term, interleukins or ILs, those are chemicals that white blood cells use to communicate between, between leukin, white blood cell. You may hear like IL-4 and IL-6 and IL-10 and things like that. All right. We talked again, these things we've kind of already talked about, your innate immune system, right? We talked about the phagocytes, mainly the dendritic cells, the macrophage, and the neutrophils, and then they generally tend to act as the antigen presenting cells to the acquired immune system or the adaptive immune system. All right. And then your specific defenses, right? So this occurs, once your barriers have been breached and the inflammatory and complement have done their thing, then you have the specific defenses, right? And this involves the T and B lymphocytes. We talked a little bit about what the T and B lymphocytes do already. All right. So remember, you have the adaptive, you have the humoral, which involves the B cells, and then you have the cell mediated, also known as the intracellular immunity. And these primarily involve the T lymphocytes, right? Now, these T lymphocytes do a lot of other things. We talked about the CD4, the CD8 proteins, and I talked about major histocompatibility complex. They can also secrete various cytokines like interleukin 1 and 2, IL-1 and IL-2, that then stimulates the synthesis of other cytokines. All right. So again, they're very good at helping things out and modulating the overall immune response. All right. So before a lymphocyte can respond to an antigen, it needs to be activated, right? So it occurs through the processed antigen fragments. And these are the APCs, right? The macrophages, the neutrophils, et cetera, that present the antigens to those B cells. And then those B cells create antibodies. And so every single antigen will have a specific antibody. And then what we do is we can actually take the antibodies and put them into several groups. And the term for antibody is an immunoglobulin, so it's a protein. So IG means immunoglobulin, and then the capital letter at the end is the category, the group of antibodies. So IgG is a group of antibodies. IgA is a group of antibodies. IgD is a group of antibodies. Does that kind of make sense? And so we'll just talk about some of the major groups. The first major group are what we call the IgG, the immunoglobulin G antibodies. And these are kind of like the classic antibodies that you see that are very effective against some bacteria, viruses definitely, and some toxins. Right? But there are some other categories of antibodies you need to be aware of. IgA antibodies are primarily located in exocrine gland secretions. So like breast milk, in your tears, your nasal fluid, and in your gastric juices, right? So IgA antibodies tend to be a little more common in your mucosal membranes. IgA antibodies are also antibodies that mom can give to the baby because of the breast milk. So IgA antibodies can be given to the baby and provide some temporary immunity, because remember, a newborn does not have an acquired immune system, right? They have not come into contact with pathogens yet. And so this kind of provides some temporary immunity. IgM is very special. IgM, first of all, it doesn't say this in the slide, but IgM is the largest antibody, and IgM is the first antibody to be produced. So IgM is created very rapidly and quickly, but it's not specific. It's not as specific to the antigen, but you can get it created very quickly. And IgM actually is several antibodies placed together. So remember I said the antibody tends to have like a Y appearance like this. And I know that if you're watching the video, you can't see this because I'm drawing on the board. So you kind of have to use your imagination. But an IgM antibody is actually several Y antibodies combined together. Like this. And then they all come together. And so you have this large round structure with the Fab fragments facing outward. And then the FCs are all combined in the middle. That's what an IgM antibody looks like under the microscope. So they're large, they're easy to create and pump out, but they're not as specific. And typically what happens is once the B cells have had time to kind of fine tune things, we call that somatic hypermutation. Then they start pumping out the normally shaped, the IgG or the IgA or whatever, that are more specific, smaller. IgD, it says important activation of B cells, maybe. It's not well understood what IgD antibodies do. And I'll just kind of leave it at that. And then IgE is actually very important because this is the one that is involved in allergic reactions. So what an allergic reaction is when your immune system thinks something that is not a pathogen is a pathogen. So it's a mistake. And typically that includes complex proteins found in pollen. It can be found in certain venoms like bee venom or Hymenoptera, which includes bees and ants and wasps and hornets. They all belong to the Hymenoptera. It can be certain part of a plant like peanuts and other foods. And what happens is when you come into contact with that, your immune system, for whatever reason, thinks that it is an antigen from a pathogen, and then it responds accordingly by causing lots of inflammation and lots of antibodies get dumped out. And in fact, the inflammation can be so bad that it can cause your blood pressure to go down, and it can cause so much swelling essentially in your airway that your throat can close off and you can not breathe, right? That's called angioedema when your airway swells up. And it can be so bad that these people may require epinephrine, right? To close those vessels down to get to decrease that swelling, angioedema, and to increase the blood pressure. So IgE antibodies are really important when it comes to allergic reactions and anaphylaxis specifically. And anaphylaxis is just a life-threatening, it's a life-threatening allergic reaction. And that is very strongly associated with IgE antibodies. All right. So what do antibodies do? We talked about them a little bit. They attack antigens directly. All right, so they actually attach to the antibody, the antigen on the pathogen or the virus infected cell, and they form what's known as an antibody antigen complex. And that can directly neutralize the pathogen or the chemical. Some other things it can do is it can cause agglutination and precipitation. So agglutination just means that several antigens are brought together. So it pulls them all together so it's easier to find them. And then precipitation means that you can't dissolve in the blood plasma. And if you can't dissolve in the blood plasma, you fall out, right? You precipitate out, and then you're not moving around the body, and it's easier for the immune system to get to you, right? And then phagocytosis, it makes it easier to phagocytize if you're agglutinated and precipitated. Does that make sense? So not only do antibodies directly attack antigens, if you will, but they can cause agglutination, precipitation, and they can enhance the ability for the immune system to phagocytize. All right. Sometimes they can neutralize toxic effects, right? And we talked about how we can even use these as antivenoms and as treatment for overdoses of certain drugs. When IgM and IgE antibodies combine with antigens, they may trigger reactions that can activate complement. Remember, I talked about complement, where complement helps enhance inflammation, enhances antibody production. It can produce a membrane attack complex, etc. All right. All right. So your primary immune response is the activation of those B and T cells. And then the secondary immune response is after the infection is dealt with, right? Those activated cells become dormant, right? And those plasma cells, those activated B cells become memory cells, and they wait for the next time that you come into contact with that antigen. All right. So they're talking about active or passive. So passive just means that you receive antibodies produced by someone else, like a baby getting IgA antibodies from breast milk. That is what we call passive immunity. Or let's say that you, maybe you have an infection, right? And you are receiving an infusion of antibodies to help treat that infection. That would be passive immunity. And then active immunity is your body is actively producing the antibodies, either in response to immunization or in response to just getting infected. All right. So some other words, anti-serum, you may hear that term. Anti-serum is given after exposure to a disease-causing microorganism. So an antiserum is generally an antibody infusion or infusing antibodies, like COVID, for example, is real common during COVID. At-risk people might receive infusions of antibodies, and sometimes they're called anti-serums. I don't tend to use that term. I tend to call them what they are, antibodies. And if it is a specific antibody that attaches to one specific antigen, that is called a monoclonal antibody. Mono being one, clone, one type of antigen. And sometimes these are actually used to treat cancer too. If you have certain cancer and you can create an antibody for those cancer cells, you can then infuse that antibody and use it to treat cancer. And so monoclonal antibodies are sometimes used as cancer therapies. Drugs like rituximab or Rituxan can attack B cells that are cancerous. So you may see that in certain kinds of lymphomas, for example. All right, naturally occurring, we talked about that. Allergic, we talked about that IgG, primarily it's IgG mediated. Allergens can trigger an allergic response. So an allergen is just something that your body thinks is an antigen, but it's really not. Like pollens and parts of plants and really anything. Tissue rejection. We see this in transplant. Like if we take an organ or tissue from one person, put it into another, even if we do our best to try to match the tissues and to match the histocompatibility complex proteins up, it's never a perfect match. No two people are exactly the same. And so there's always a risk that the immune system will attack that organ. And so typically what we have to do is if people have received organ transplants, we will need to actually suppress their immune system with drugs that prevent rejection, which means anyone who's had an organ transplant is going to be at risk for developing infections and cancers. Autoimmunity, that's where the immune system fails to distinguish self and non-self. I talked about autoimmune diseases. And this is a huge problem. Many examples. Lupus is one example. I talked about type 1 diabetes, rheumatoid arthritis, Crohn's disease, ulcerative colitis. Many of your thyroid diseases, hyper and hypothyroidism, are the most common causes of thyroid dysfunction is autoimmune diseases. And let's see, Guillain-Barré, which is a neurological condition. Myasthenia gravis, where the body attacks acetylcholine receptors, is another. So many types of autoimmune diseases out there. And an infectious disease just means this is a disease that can be transmitted from one person to another. All right. Most frequent infectious diseases seen by us tend to be serious. And that makes sense, right? Because if someone has a little pimple on their butt, they just pop it and go on with their day, right? So when you're getting called, if an infectious disease is involved, it tends to be a little more serious. Pneumonia or an infection in the lungs is very common. Hepatitis may be involved. That's typically a viral infection of the liver. And there are many different viruses, hepatitis A, B, C, and so on. And then there are just a few examples that we're going to talk about. Hepatitis. It doesn't actually say what type of hepatitis in this slide, though. But hepatitis B and C are the big baddies that we really worry about. A tends to be self-limiting. It tends to be, you get some nausea and vomiting, maybe a little jaundice and you get over it. But B and C are the viruses, the infections that can become chronic and cause chronic liver failure and even cancer. Tuberculosis is a bacterial infection, generally involves the lungs, but it can involve other areas of the body like the kidneys. But often involves the lungs because it is a very aerobic organism, needs lots of oxygen, so it tends to be in the lungs. Transmitted through respiratory droplets, and it's like a really slow, progressive infection. It tends to be much more prevalent where you have large concentrations of compromised individuals. And people that have not been properly treated for tuberculosis. It's not a huge threat in the United States right now, but are the medications that we're using, the antibiotics for tuberculosis, because it's a bacteria, mycobacterium tuberculosis. Many of our antibiotics are failing to work. Tuberculosis is becoming really resistant. So you have something called MDR-TB or multi-drug resistant tuberculosis and XDR-TB or extreme drug resistant TB. And there are some areas of the world where we are no longer able to treat tuberculosis. So we're regressing back to the 1800s essentially. And, there are certain areas in India and Russia, for example, where if you get TB and it's an XDR TB, there may not be any antibiotics that are effective. And essentially it's like you need to go to a TB asylum and boy, I hope your immune system can do something about it because we don't have anything for you. Common modes of disease transmission, airborne, really common, it can be droplets, body substances, blood tends to be the most common substance, injection, needle sticks, foreign bodies, bites and stings, the mosquito, for example. Mosquitoes are horrible, really act as a vector for transmitting all sorts of horrible infections like West Nile virus. Let's see here, malaria is another one. Certain biting flies, like sleeping sickness and the tsetse fly. In Africa is a big problem. Ticks here in the United States act as a good vector for Lyme disease, Rocky Mountain spotted fever. All right, so disease-causing agents, bacteria, viruses, fungi, protozoa, nematodes. A prion is a very special kind of thing. So a prion is actually not an organism. It's actually just a protein. It is a malfolded protein. And that's actually what a prion literally means protein infective particle. And essentially what happens is you get this malfolded protein, and then that malfolded protein bumps into another protein and causes that to malfold. And then that bumps into another protein and causes it to fold abnormally. And you kind of get this chain reaction occurring. Prion diseases tend to involve the nervous system. And I don't know if you ever heard of the term mad cow disease. Have you heard of that? That's actually a prion, a misfolded protein in primarily in cow brains, in bovine. And there's also something that happens in ungulates. Ungulates are smaller, typically four-legged, hairy critters that eat grass mainly. So think of like deer, antelope, things like that. And there is a prion disease that is really a big problem here in the United States. And it involves mainly deer, and in areas it's pretty devastating for deer. It's called chronic wasting disease, or CWD. And so far it hasn't crossed over to humans, but you know, there's always a chance. But there are prion diseases of humans as well. Something called Creutzfeldt-Jakob disease, or CJD, is probably the most common example. And we see this is more common in areas where human beings are eating other people, in cannibalistic cultures, areas like Papua New Guinea. But this can spontaneously occur in anybody. Anyone can spontaneously have proteins that malfold in their brain and cause Creutzfeldt-Jakob disease. Generally, we see it in older people. There are certain types that can impact younger people, and it can just happen spontaneously. It's not super common, but it can happen. And then obviously, it can be contagious if you end up coming into contact with the body substances of someone who has this, specifically if they've had like surgery, like neurosurgery. And because there's nothing to kill, right? It's not an organism. It's very hard to decontaminate it. Because it's not a pathogen, it's just a protein that's malfolded. All right, so we talked about bacteria. They're small, single-celled organisms. They're capable of independent existence. They tend to be classified not only based on their shape, but that is one way of classifying them, by shape. So if they're round, we call them, it's called a coccus or cocci, is plural. So round is a coccus, or cocci if you're talking plural, right? If they're elongated and they look like little pills, those are called bacilli, or bacillus for singular. All right. If they are twisted and they have like a corkscrew-like structure, those are called spirochetes. And then when we look at them, how they arrange themselves is also another way of classifying them. For example, if they arrange themselves in like these lines, like this, we call that strep. And then if they are these chains of cocci, we would call that streptococcus. Does that make sense? And then if they form little grape-like clusters, like that, look like little grape clusters, we call that staph and staphylococcus, right? So that's where those terms come from. We'd also categorize them by how they stain. So you can do staining and how they absorb certain stains, specifically crystal violet. And if they absorb the crystal violet, we say that they're gram-positive. And if they don't, we say that they're gram-negative. And that has to do with a thick, hard carbohydrate substance in the cell wall of the bacteria called peptidoglycan. That they have a thick layer of it, they tend to be gram-positive. And they're really good at living outside of the body, whereas the gram-negatives tend not to be as good living outside of the body. So the gram-negative bacteria tend to be like in your urine and your gut. The gram-positives tend to be on your skin. So like strep and staph are gram-positive, whereas E. coli tends to be like gram-negative. And these cause many of the severe human infections like TB, urinary infections or UTIs, pneumonias, plague, Yersinia pestis, the bacteria that causes the plague. All right. Viruses are small particles Unlike bacteria, a virus cannot live independently. It requires a cell to divide. And so viruses are what we call intracellular parasites. And so essentially what a virus is a virus is a chunk of genetic material surrounded by a protein capsule. And then sometimes that capsule may be surrounded by a membrane. Sometimes not. If it is surrounded by a membrane, we say that it is an envelope virus. And if they're not, we say that it's non-envelope. But a basic structure of a virus is some genetic material and then a protein capsule around that genetic material. And you guys have covered pharmacology in your EMT class already. So you know the concept of an auto-injector. That's essentially what a virus is. A virus is an auto-injector. And it's just floating around. And if it bumps into the right kind of cell, it'll activate, right? It'll be like touching the auto-injector and it will inject its material, its DNA or RNA into that cell, reprogram that cell and convert that cell into a virus factory. And then that cell will produce more viruses and typically it will die. That's how a virus works. Viruses cause lots of respiratory infections. Most of your common colds, your coughs, your sneezing, sniffling stuff, bronchitis, RSV, croup, all that stuff tends to be caused by viruses. Fungi and protozoa, these are more fungi specifically are more plant-like, like yeasts. They can cause lots of infections, like athlete's foot. The most common that we run into is candida, like Candida albicans tends to be one of the most common problematic fungi that causes athlete's foot, ringworm. Okay, that's all fungal. Protozoals are single cell animal-like microorganisms. They tend to be able to move themselves around. You don't see that with bacteria. They're single cell, they can't really move on their own. Whereas a lot of these protozoa have little flagella that they can use to move around. So amoebas, plasmodia. Plasmodium can cause malaria, and there are different types like Plasmodium vivax or P. vivax or Plasmodium falciparum, P. falciparum. Yeah, those are different causes for malaria. Nematodes are little worms. They include roundworms, penworms, and hookworms, and they tend to infect your gastrointestinal tract. They can sometimes leave the GI tract and go into other areas of your body, like your brain. And I talked about prions or prions already. All right, normal flora. This is sometimes referred to as your microbiome. This is the normal bacteria that exists in areas of your body. Most commonly in your GI tract. You actually need to have bacteria in your GI tract to help you digest and absorb foods. But what can happen is if something occurs that kills off the normal bacteria, the abnormal bacteria can then recolonize. So typically what happens is the bad bacteria is kind of kept in check by the good bacteria or the fungus. Like you've got fungus all over your body and it's kept in check by the other microorganisms. And so if you take an antibiotic and it wipes out a lot of the good bacteria, then you may develop a fungal infection as a consequence of that, right? And so the microbiome, a healthy microbiome, normal flora is actually really important. And people that are sick or severely injured, their microbiome may be altered and they may be at very high risk for developing these what are called opportunistic infections. Okay, that is the end of that, and it is almost 3 o'clock. Oh, just a little after 3, so perfect. Just a little over 2 hours. I think we got through everything. Do you guys have any questions? All right, that's all I got. get out of here. Have a great week, and I'll probably be lecturing next week as well. Not sure what's on the agenda for next week's lecture, but
I think the midterm is coming up.
it is. Well, I know we just had spring break. But I know we still have some major systems to get through, like the nervous system. We haven't talked about. So some of that is upcoming. All right. Get out here. Have a great day. Be safe out there. I know the weather is not awesome, so. All right.